Good morning. My name is Richard Ponte, and I'm the Director of Events and Programs for the Maine State Chamber of Commerce. And on behalf of the entire team here, it is my pleasure to welcome you to our 2024 Healthcare Forum. Before we get going, there are just a few things we'd like to share with you about today's session. If not presenting, please turn off video. To reduce background noise, all participants will stay in listen-only mode. Please stay on mute to reduce noise. And please submit questions into the chat panel addressed to everyone. Time permitting, we will answer them by the end of the session. We will also use the chat function to share useful links and other materials. This meeting is being recorded, and we will make sure the recording is available to you on our website in the next few days. And finally, if you lose your connection, please use the same link to reconnect. We would now like to begin by thanking our sponsors. Our premier sponsor this morning is Harvard Pilgrim Healthcare. Our principal sponsor is Anthem Blue Cross and Blue Shield. Our break sponsor is Novo Nordisk. Our program sponsor is Martins Point Healthcare. And our supporting sponsors are AmeriHealth, Caritas, Cross Insurance, Maine Dental Association, Maine Health, and Northern Light Health. Again, many thanks for their support. And now I will turn it over to Jeff Sedlack, who serves as the Medical Director of Maine for the Point 32 Health Foundation, Harvard Pilgrim Healthcare. Jeff will kick off this morning's conversations with all of our awesome panelists. Good morning, Jeff.
Good morning, Richard. How are you?
I am doing good now that we figured this out.
Well, this is interesting, and this is actually almost a poetic start to this, because what we're going to talk about is, and we've got some incredibly interesting Mainers here to hear from to talk about housing. And housing ultimately is a communication issue. How are we handling things? How are we doing it? And what are our goals? I want to go back just briefly to April 22nd, 1912, with the start of the Chamber of Commerce and the origin day of the Chamber of Commerce. And it was a really interesting thing because we had all kinds of new communications developing and things that needed to be done in order for us all to do well, to really excel as a country. And the Chamber has been and continues to be incredibly useful in this regard. And we had the trains developing and the wireless developing and all kinds of things improving our communication. And I notice now when we're having another housing crisis, we're on a virtual event. And there's more and more telehealth coming. And we'll talk a little bit about that. But we're in the middle of another transition, and we're seeing housing as being one of the 2 or 3 principal areas that we have to address as a community. And so with that, I want to turn over to Paul Peck, who's actually a Northern Mainer living in Portland, who's been all over and who does housing financing, does a lot of the communication that we need to do. And I can't do them well enough in an introduction. So I'm just going to turn it over to him.
Well, thank you and good morning to everybody. I'm Paul Peck. I'm a developer with my own company, LWS Development. I'm an attorney with Drummond & Drummond. I'm a vice president of Western Maine Mountain Housing, which is a Western Maine Mountain area that we would like to build some workforce housing around the Kingfield, Carrabassett, Stratton, Eustis area, the High Peaks area. That's a little background. There's so much to talk about, so I'm just going to get right to it. I think I'm here because someone reached out to the Western Maine Mountain Housing to get our take on what's happening in the rural areas of Maine. I can give some perspective to that, but also talk about just general building constraints and why it's so difficult to build workforce housing in any housing right now. We proposed in Kingfield a 40 unit development for workforce housing. Our first project was going to be 18 apartment buildings for those making 80% of area median income. The problem with these rural communities like Kingfield is the zoning doesn't allow for any density at all. So we had to go to the town and have them pass an ordinance that allowed contract zoning. Once that was passed, we then had to go to the town and have our contract approved by the voters. We had a great plan. We spent about $100,000 on site design and all the lawyers' fees involved and architects and engineers. We went to a vote and we lost resoundingly 400 to 150 because the townspeople didn't want any government subsidized housing in their town. They thought we were going to be bringing up immigrants from Portland to live there, where we just wanted to house workers. We wanted to, including, we referenced and talked to the medical professionals up there, the health clinic up there. But we got killed by xenophobic and somewhat racist thoughts on the housing we were going to build. And that sort of was a wake-up call for us. Although, NIMBYs, not in my backyard, they're in every town in Maine. Zoning laws in every town in Maine are difficult, other than the cities that have some density, like Bangor, Lewiston, Auburn, Portland, have some density you can build. But the zoning laws in Maine are very local control. Every town has their own zoning laws, their own densities, and there's a ton of local control. And local control doesn't really work for density, doesn't really work for subsidized housing in any way. So we need to work on local control issues. We're doing that I'm also on the board of directors of the Maine Real Estate Development Association. And we've just had a law passed that allows, that prohibits towns from changing the zoning once someone puts in an application for housing related development. There was a big 500 unit development in Kittery that was killed after it was all submitted by a town vote and referendum to change the zoning. So we need more centralized control for housing up in Augusta, passing laws that help us. And the housing committee in Augusta is doing great work. Even though there's a zoning issue, a density issue, it's really hard to build any kind of housing that's subsidized, because there's so few programs in Maine and around this country that allow that. Maine State Housing has some programs through Maine. The feds have some programs, but they're all really geared to 60% AMI and lower. So it's those making really low wages and not healthcare professionals or healthcare workers. In Kingfield, our top income for a single person was going to be $42,000, which would have done that entry level workforce housing for medical, for professionals, for EMTs, and alike. But there's very few subsidies available to build the housing, the workforce housing, 100% AMI, maybe to 120% AMI, or 80 to 120%. Very few vehicles to do that. And therefore, it doesn't get built unless it's within those programs at 60% or lower of AMI. There's a few programs that go to 80, few programs that go to 120, but very, very little. But even right now, even if it's very difficult to build market rate housing because interest rates are high, not necessarily high in the last 50 years. They're almost normal, but given land costs, construction costs, regulatory approvals, it's very, very difficult to build market rate housing. We had a window from like 2015 to 2022, that rates were low, costs were okay, demand was high. Right now, none of that exists. So it's really hard to even build market rate housing as opposed to subsidized housing. There are organizations all around the state working on this, and we need to do this collaboratively to change some laws in Augusta to build support, community support for the housing we need for our workers and the medical workers, obviously. Maine Affordable Housing Coalition is one giant organization that does great work. There's other organizations, MRETA, the Maine Real Estate Development Association. There's local agencies, Portland Housing, Bangor Housing, Westbrook Housing. They're doing great work. There's really good developers in the field. Nathan Zanton, Kevin Bunker are doing great work around the state. but we need more programs, more subsidy, and we really need to change the laws around the state to allow the density we need for the workers that can come to those towns and provide the services that are needed. That's really it in a nutshell. I mean, I'm a lawyer. I can talk really fast and get a lot of information out there. I'm not a Mainer. I moved here in 88. Thank you, Jeff, for thinking I was. My kids are, but I'm not. I guess that's all I have in a nutshell.
Great. Well, I think that I'm supposed to take over. So
Oh,
I'll
sorry,
just,
Jess.
that's all right, Paul. No, no worries at all. See a lawyer, talking to a lawyer, we just take right over. So I'm Jess Maurer. I am the executive director of the Maine Council on Aging, and we're a broad multidisciplinary network of about 135 organizations, municipalities, and businesses working collectively to make sure we can all live healthy, engaged, secure lives as we age in our homes and communities. And I couldn't agree more with what Paul just said, and have spent a lot of time thinking about what do we do until we get to that place. And so just from a perspective point of view, right, we're living longer than we ever have before, 30 years longer actually in this country. And yet our working practices are sort of still stuck in the 1950s, 60s, 70s. So we're all still thinking, oh, geez, I'm going to get to 65 and leave my job. And a lot of people are leaving a lot earlier than that. But they have no intention of leaving their homes. We ask people and they're like, no, never leaving. And so for this reason, we're kind of in this mess, right? It's a good problem to have. We're living longer, healthier lives. But when we give up our work, right, we need a worker to come take our job. And it used to be that, like 5 or 10 years later, we die. Now, 30 years later, we die. So we're staying in our houses much longer. And so it's kind of messy in this transition period as we need to build more housing and think about building different housing. But for older people in particular, right, as we live into our 80s, 90s, and 100s, we're also finding that our traditional housing that have always worked for us, right, doesn't work anymore. Two-story home, only bathroom on the second floor. You can't go upstairs. You can't stay in your home. So we've got a real housing mismatch. And what we have all over Maine, literally all over Maine, are single people, older people, sometimes an older couple, living in houses that were intended for families that are hard to maintain into later life, with no place for older folks to move to within their communities. And that's we're going to talk a lot about health. Staying in one's community is the best thing for a person. And so what we typically do, how we typically create affordable housing for older people, right, is density. And so we put those in small or moderate size or even larger cities, which means that people have to leave their homes and they have their communities, right, their church, their families, their social structure, their knitting club, their book club, their tennis club, whatever it is. They're leaving their friends behind, which means they're going to do less well in relation to their health when they leave those social structures behind. So we really haven't built what's next. So as sort of different from workforce housing, thinking about, right, how do you build the next level of universally designed homes, small homes, not necessarily apartments, in small communities that are affordable, so that people can leave their larger homes, making those available for families and for workers. And until we get there, I think we're going to continue to be in this sort of dog chasing its tail kind of thing. We're not going to free up those homes. So it'll take decades either way we go. It's very hard to build lots of affordable housing. So we've been really thinking about, practically speaking, how do we help people stay where we are? We started looking really at home repair, making sure that people could stay safely at home and modify their homes to work for them while they were waiting for the next thing to be built, or waiting for an affordable apartment to become available somewhere. Then turned our attention to accessory dwelling units, which we think are a good solution for some people. You can share your home, but but completely independently, right? Either subdividing an existing larger home, or actually building a detached accessory dwelling unit. We've obviously made some really big progress. When we started this conversation 12 years ago, it totally depended on where you lived, whether or not your town would allow you to build an accessory dwelling unit, and one town would say yes, and the next town would say no. And obviously, that's not fair, as Paul was just talking about, even just around how we zone these other types of affordable housing. So, we've made progress, obviously, now that we've got more consistent rules across the state in relation to the allowance of accessory dwelling units. Really great work by the legislature and the housing committee, really all moving us in the right direction, but still really hard for folks. We need financing options, project management, and obviously need to think about how we build affordability into accessory dwelling units so that we can make them more prolific in Maine. So finally, I think one of the reasons why I got tapped is that there is something sort of new on the horizon that we wanted to share with you all, which is home sharing, which is, again, something we've been talking about for more than a decade. And other states, Vermont, for instance, 2 states over, has had couple of home sharing programs, very successful for more than 20 years. So this has been around for a long time, but it really allows somebody to share their space with a single worker, a couple, even a family, depending on the space they have and the kinds of willingness older people have in particular, because I said, those are often the ones that have a lot of space in their homes to share. It's been around for a long time, but particularly older people are hesitant to let strangers come into their home without a level of trust. And so last year, the legislature authorized Maine Housing to launch a pilot program, and they sent out an RFP, and they have chosen a company called Nesterly, which is a national organization that's been working really successfully in some other communities to support home sharing, which I think is the key here, is the trusted source, and that needs to be really a supported relationship. Nesterly is an organization that does background checks for both the host, they call them, and the renter. They interview both parties, they do matching, they create the rental agreements, they negotiate reduced rents in exchange for negotiated help. They collect and distribute payments, and they help with conflict resolution. We've been really focused on getting the word out since the early part of this year, to begin to create a steady supply of hosts, which we've had a whole bunch of people sign up. You can actually go to, and I actually preloaded this so that y'all could go there. You can go to the Maine Housing Nesterly site and click through, and you can see that there are hosts pretty much all over Maine. And the key here will be for really getting the word out, to get more people to sign up. We've got a great coalition of people who are working on this. And in June, actually, just a week away, we're going to start doing matching. And I think they've already made a few successful matches, but have been really focused on growing the number of hosts before they expand out there. But this is a terrific opportunity, particularly for healthcare people who are coming in, residents in residency programs, travelers, those sorts of things. Really good options for sort of shorter to longer term housing solutions for our workforce. So I think what I'll say is, I'm going to talk about some other things later on. I will stop there and turn things over to, and we're back on track, by the way, to Emily Flingstrom, who is the Executive Director of Fair Trade. Emily?
Thanks, Jess. Yes, I'm the executive director of Fair Tide, actually, but very common mistake. That's okay.
Sorry about that.
That's okay. We are a nonprofit serving the very southern part of Maine, actually into Seacoast, New Hampshire. And we focus on affordable housing and supportive services, specifically geared toward people who have experienced homelessness. And I think the two speakers before me kind of laid the foundation for why we are in this housing crisis we're in. Housing, if we look at it as a spectrum, we're stuck. Nobody's moving anywhere. So we have, as Jess mentioned, older folks living in, these large single family homes who have no way to downsize. And therefore those families who may want to move into those homes out of a rental cannot move out of that rental. So now our rental market's stuck. So, that's we really need to be attacking the housing crisis from all different angles, and in lots of creative ways, but we need to create housing opportunities for folks along the entire economic spectrum. Our focus, as I said before, is specifically on those who are kind of fall at 30% or less of the area median income. And we develop deeply affordable supportive housing for those individuals. We are in the process of growing at the moment. And so we have one 5-unit house that we own here in Kittery, and we have 2 additional supportive housing projects that are in our development pipeline right now. And our intention is to continue with that momentum and continue to build these housing developments in the southern part of our state, so that those who are kind of impacted greatly by the housing crisis and finding themselves without anywhere to go can move out of our homeless shelters and into stable housing and kind of get things moving. And housing really is, the foundation that's needed for anything else in life, right? If we're talking about health here, you need stable housing in order to address any other aspects of physical health, mental health. And there are, countless negative impacts of, to our health if we don't have that stable foundation, and specifically if we are experiencing homelessness. So we are, in the process of developing additional units of deeply affordable housing. And we also, in the meantime, because development takes a long time, we launched a program a couple of years ago that focuses on partnerships with landlords. So the idea is to try to open up opportunities in the private rental market to individuals that we work with, often who have housing vouchers. So we offer a variety of different incentives for landlords to partner with us. They get up to $2,000 in a sign-on bonus. There's a risk mitigation fund for any damages above and beyond what a security deposit would pay. And really what we're finding as the most attractive incentive is support from our case manager. So we have a case manager that works very closely with all of the households that we place into housing. So she is a resource not just for the tenant, but also for that landlord who may have never had an experience working with somebody with a voucher. It kind of takes the unknown out of the situation, knowing that she's just a phone call away, that the idea would be that, she could nip any potential issues in the bud before they become actual issues. So we have kind of those 2 programs are where we have focused our growth in terms of opening up housing opportunities, but we also are growing our supportive services side of things. And really the model that we implement is housing and support. And that's really the key to success, so that, if you can start with that housing, which is absolutely critical, but if we don't have those supports on the other side, then it's more likely that somebody will fall back into homelessness. And so we offer that long-term case management support. We have emergency funds for individuals that may just need help with a car repair or a utility bill that otherwise would put them right back into homelessness. And then the other piece and project that we are working on that's very exciting is more of a changing the entire system of social service delivery. So what we found as a group of agencies down here in this part of the state, but also I'm sure is very similar throughout our entire state and the nation, is that it's more common to work in silos, right? That we focus on our own agency's mission. And while we try to work collaboratively with the other providers in the area, it's very difficult when everybody's kind of scattered around town or around the region or the state. And we're just not making progress. We're not making a dent. Actually, we're seeing the issues that individuals are experiencing be exacerbated. And so we came together and decided we were going to develop a one-stop shop resource hub of social services. So a handful of agencies are going to be offering their programs, their services under one roof. It's based here in Kittery, but it'll, again, serve the entire southern part of our state. And it's going to act as a really great tool for homelessness prevention. Because again, with our housing market the way it is, we can't afford to have more individuals fall into homelessness. So we will be addressing a variety of issues. Many of the social determinants of health will be, there'll be resources to support individuals under this one roof. So we'll have services for veterans, we'll have legal aid, we'll have adult education classes, we'll have support for individuals that struggle with substance use. mental and behavioral health resources. Actually, Maine Health is a partner of ours and is going to be offering prescription assistance and health insurance navigation a couple days a week under the umbrella of Mainspring, which is the name of this hub. We're in conversations with York Hospital and Portsmouth Hospital, which are the closest hospitals to us down here, about how they can participate in the solution. And specifically, make sure that we are getting individuals into the healthcare system that may otherwise have barriers to accessing healthcare. And we're going beyond just the co-location model to really trying to truly collaborate and wrap our arms around these households. And the ultimate goal would be to help households navigate the pathway out of poverty. So we're looking at centralized intake and shared data and case conferencing, and really all those features that make Mainspring a step above in terms of changing the system and changing the way that we really do things now, which is sort of fragmented, difficult to navigate, and difficult to access. So we will have the doors open to Mainspring later this year. It actually sits right next door to one of the housing developments that Fairtide is working on. So again, that idea of having housing and supportive services hand in hand is really the model that we are working toward. So that's kind of the nutshell of what Fairtide is doing. I just wanted to step back for a minute though and mention the other kind of piece of our work, which is the advocacy side of things. And as Paul was mentioning, and you pointed out the project in Kittery that got turned down, I am very involved in our local advocacy around zoning changes. I mean, we worked for 4 years before we were able to do any of these projects, just focusing on Kittery. And so, our intention is to grow beyond the Kittery community into our neighboring communities now that we have a director of housing whose sole focus is on making sure that we can build more housing. But that local advocacy is so important. And then I also sit on a regional homeless council and the statewide homeless council, and I'm involved in various other coalitions and groups that are really pounding the pavement and driving home the point that Paul and that Jess made, that we need more housing at all levels, and trying to bring about change to make that happen. Because the truth is that housing, lack of affordable housing, and if we have individuals in our community who are struggling, that impacts not just those individuals, but it impacts our entire community, our entire region, our entire state. And so it should be something that we're all coming together on and letting our voices be heard, because otherwise the future of our state, I think, is not looking great. So I think this is what a great forum to be here this morning and be able to hopefully inspire some others, specifically in the business community, to come out and become a YIMBY instead of a NIMBY, and make a difference in that way. And I'm going to go ahead and pass it over to Christopher Hinshaw.
Good morning, everybody. My name is Christopher Hinshaw, and I'm the Executive Director of the Greater East Grand Economic Council, formed in 2021, not-for-profit. I was hired this past September and have been on the job for about the last 8 months. My focus here is not exclusively on housing, but it is an issue I address, and I think Jeff invited me because I think I represent an area with some of the greatest rural poverty in Maine. I'm pleased to be a part of the panel. I represent a large, rural, underserved and remote geographical area of Maine, including 12 small towns and unorganized territories, starting about 100 miles north and east of Bangor and 30 miles south of Holton along the Canadian border. The largest town I represent is Danforth. It has 550 people. The region's year-long population is roughly 2,000, and it doubles in the summer months with lake people. This region has been in steady decline for over 100 years, with particular decline since the 1950s, when machines replaced loggers and trains replaced trucks, leading to the decline of the two major industries responsible for providing jobs. The loss of these critical industries led to a domino effect. The loss of jobs led to a loss of supporting infrastructures required to sustain local communities. As more and more stores closed and services disappeared, people have moved away, and younger people were unable to find jobs. Now, in this region, we have one small grocery store, one K-12 school with 140 students, one hardware store, a health clinic, and one truck stop cafe. The loss of any of these remaining businesses would have a devastating impact on the local economy. Just to give you some frame of reference, median family income here is about $50,000 a year. My first 6 months in the job involved travel and conversation with local people to learn about their concerns, about what they believe should be done to improve the economic conditions of the region. It has been imperative that this be a locally citizen-driven initiative, not a top-down approach driven from some outside entity. And after extensive listening, I resolved that for the area to have a reasonable chance of economic revitalization, we need to do the following three things. Develop a robust year-round place-based outdoor recreational economy with an emphasis on local business and job creation. This area needs to become branded and a tourist destination location. The wilderness recreational opportunities that surround us is our greatest asset, and we need to find a way to attract more people here. With high-speed broadband internet arriving this summer, we need to build middle-income housing over the next several years and make it possible for people to work from home. And we hope this can bring in new residents and grow the population. If we can provide new housing, we hope to encourage small-scale and micro businesses, artists and craftspersons, small farms and homesteads that can help rebuild the regional economy. My first priority is to assist the local health clinic to research about the feasibility of building housing next to their clinic to provide small-scale housing units that allow seniors to age in place, thus freeing up their larger homes that could perhaps be purchased by new people moving into the area. There is anecdotal evidence to suggest this may be a need, but we need to verify it. One major part of this research is to conduct an extensive survey of the local senior population to determine how many of our elderly population would be interested and capable to move, and what kinds of rents or purchase prices they could afford. Scarcity is the largest contributor to our housing challenge, followed secondly by a lack of local contractors. An example of how serious our housing challenge is that I have recently learned that the school has hired a new principal from away, but he is unable to find any place to live, even to rent, in the entire region. In addition, the local health clinic is having a challenging time finding a new doctor to attract to the region because there's no housing. Finally, the new director of the Woody Wheaton Land Trust in Forest City recently resigned after 6 months on the job, as she too was unable to find a place to live or rent. And I will close with a few challenges that I have faced. There's a great deal of town thinking versus regional thinking. So for example, people in Weston aren't particularly interested in what happens in Danforth, only 3 miles away. It's been difficult to get people to get together to talk about the larger threat. Despite the well-known challenge of lack of housing and jobs, there appears to be little sense of urgency. People are largely focused on day-to-day living, not long-term issues, and I'm increasingly understanding this as part of intergenerational poverty. Not everyone is extremely poor here, but most people are. And so it's challenging. They're just trying to get by day to day. And then finally, local people are fiercely independent and suspicious of outsiders like myself. It takes a lot of work to build trust and goodwill. We are unlikely to have local regional investors because people who have the means are probably unlikely to take a risk in investment. I think in the end, we're going to have considerable private-public partnerships to build new housing. Thank you. Pleasure to be a part of this panel.
Four years in, I still forget to unmute. Thank you, Christopher, Emily, Jess, and Paul. Really, really insightful comments and helpful to get perspectives from across the state. I'm Ellery McNiff-Daniels. I am with Point 32 Health Foundation, and I'm here with my colleagues from Harvard Pilgrim Health Plan to help you hear a little bit more from our panelists, and I encourage folks who have questions to drop them in the chat. We'll either incorporate them into this first part of the Q&A or bring them on later as they come in. So if you have questions, please drop them into the chat, and we'll keep an eye on that. But we have a few pre-populated that I'll get started on in just a moment. Before I do that, I do want to build on something that Emily said and just make sure to provide a definition. I don't want to assume that everybody understands the concept of social determinants of health. Emily did a really lovely job of making the point that housing is really important to an individual and a community's health. And those of us who work in the healthcare environment understand this concept that health does not just happen in your doctor's office, when you pick up your prescription at the pharmacy, or when you have an emergency and have to go get a broken bone set. Health happens where we live, work, and play. And that is what we're talking about here today, that housing is essential to health. Recreational opportunities are essential to health. Education, all of these community factors influence our ability to be healthy as individuals and to have healthy, thriving communities and healthy, thriving businesses because our employees are healthy. So just wanted to make sure that I provided that a little bit of extra context on this concept of social determinants of health and how housing fits into that. And now I'm going to turn back to Emily. And I'm interested to pull a little bit on the thread of partnerships and this idea of creating partnerships and bringing social services and other agencies together to meet community needs. I'm wondering how you engaged community in forming the partnerships, and if you could possibly share, it's really easy to share the lessons learned and what does work, but maybe something that you learned that doesn't work that others would benefit from understanding.
Yeah, partnerships are really the only reason that Fairtide has been able to grow over the last 8 years. When I first started back in 2016, we were a really small agency, and I was actually hired to grow Fairtide because there's such a great demand for housing and supportive services. And I went to the board with this really ambitious plan. And at the very bottom of that plan, I wrote, leveraging partnerships is going to be key to making this happen, because, it's one way for us to get out of our silos that I was mentioning earlier, that we have strengths at Fairtide, our other agency partners have their own strengths. There's limited resources, so we really need to be working together to figure out, how we can make a dent in the housing crisis, but also other, large issues that we're facing. So I think I actually want to start by talking about, because this is sort of housing focused, our partnership with the town of Kittery, just as an example, because this strong partnership is the way that we've been able to move forward on a couple of these housing developments. And it's the way that we will continue to move forward on hopefully future housing developments in other communities. Like I was mentioning before, it took several years for us to lay that groundwork to make the housing possible. I joined the Kittery Housing Committee. Actually, the Kittery Housing Committee was started right about the time that I started in this job. And we were created to advance affordable housing initiatives in Kittery. And we've had some really great success. We've had some setbacks, but one thing we immediately started focusing on was zoning, because, Paul kind of drove this point home, but zoning is really one of the major barriers to housing development, to affordable housing development. And so we were able to change the density and added affordable housing, inclusionary zoning component to a couple of the zones in town, which means that any housing development over 5 units must include 10% that are affordable to people making 80% of the median income or less. And so we had some initial success up front. Then we had the community come forward and put the brakes on a little bit. They were a little bit worried about the progress we were making, I suppose, and a little scared about what that meant for our town. And so we went back and we created an education subcommittee under the Kittery Housing Committee. And our whole goal for an entire year was to help our community understand the basics of affordable housing, how it's built, who would live there, what does it look like if it's built in our community, where should it be built? So that was, really intentional to engage the community in these conversations and to try to get to the root of some of the fears and the misunderstandings and misconceptions about what affordable housing really is. And the question that I always like to ask is, what will our community look like if we don't do anything? Because I think there's a fear of what will it look like if this is built or that's built or this ordinance is changed. Well, that's one question, but I think at the same time, we need to be looking at what the consequences are if we keep going in the direction we're going, and it's not great. So, but I think to the point of engaging the community, that has been really critical in allowing us to move forward with some of these measures. We also created an ADU grant program where we offer, our first round was up to $50,000 for a household to build an ADU on their property. The household had to qualify at a certain income level, and the renters that will be in the ADU have to qualify at a certain income level. We are now in the second round of that grant program, and we've upped it to $75,000 that a household can get in order to build an ADU. And we're able to partner that with Fairtide's landlord program so that hopefully some of these accessory dwelling units that are built can actually be rented to individuals with vouchers, which then creates those more deeply affordable housing opportunities. So there's been a lot of great change that has happened at the local level. And I think to your question, Alri, about community engagement, that's been such a critical factor. I'm also part of a coalition here in the Seacoast that brings a bunch of agencies together to focus on homelessness and affordable housing. And we just launched an effort to hold local house parties where we have somebody in the community that's at least somewhat interested in affordable housing, get their friends to come to their house. And we're going to go, dinner party by dinner party and talk about how is this impacting you? What are your fears? Do a little bit of education in the meantime to get more local individuals into the pipeline of at least being open to showing up at a public hearing and saying yes. So the next step beyond having these house party engagements would be, okay, here's a training for local advocacy that we'd love for you to attend so that you're armed with the resources and the knowledge so you can feel comfortable coming out and speaking in favor of some of these changes and some of these projects. So again, it's so critical, these partnerships, this community engagement. We're also lots of partnership building with Mainspring, the collaborative resource hub we're building. I think that what has not gone well, I think when you don't engage community, it doesn't go well. I think that's, just in general, that same thing with Mainspring. I think it's being transparent and really stepping back as an agency and saying, okay, we are really working on something that's bigger than us. Like Mainspring's bigger than us. This issue of affordable housing is bigger than us. We need to set whatever agency ego or individual egos we have aside and come together to address these crises. Because if we're not coming at it in that way, there's all these other questions and hesitations that come up. And so we've successfully been engaged in a joint capital campaign with our local food pantry to build Mainspring. That took months and months of conversation up front with both of our boards saying, we're not raising money for Fairtide. We're not raising money for Footprints Food Pantry. We're raising money for Mainspring. This is a community initiative. So I think that has been a really critical piece of it. I could go on, but I'm going to stop there.
Thank you, Emily. I hadn't heard about the dinner parties before, and I'm fascinated at that personal connection, to have those conversations, to hear what the misperceptions are and have that opportunity to have those one-on-one conversations about fears and impact and what happens if we don't do anything. I think that can be really, really powerful, especially in places where people just don't know, right? They're just living their own lives and they just don't know. And just
could I just take a second and add
absolutely
to my friend Emily just said, is that the key to all of these developments is what's the local involvement and how are you going to let the local folks run their future? Because coming in and what we found we had a big work in Baileyville which again was, okay, we're going to come in and do this for you. And they told us to go away. And as it developed into what is, okay, you're in charge. What do you want to do? How do you want to do it and everything? It became much more successful because they're perfectly, it's their community and it's them and they're taking care of themselves and they do. And that's why I think that between Christopher and Emily, between everybody here, this has been a local adventure with some statewide support. And I was delighted to see the number of people from local chambers of commerce, that were here to this. This is what I really wanted to get to. And so I just wanted to thank Emily again for saying what's really real. It's not people coming from the state that does this. It's the local people getting help figuring out how to do it themselves.
And Jeff, I suspect you would agree with this. It's harder and it might take longer and it might be a case of one step forward, a half step back or 2 steps back, but that inclusive approach.
It's imminently more successful.
Yeah. Thank you for that. Thank you, Emily. Thank you, Jeff. So Jess, this conversation is making me think a little bit more about the leadership exchange on ageism. And I had a question that I think you can answer as well. I had a question for you about the importance of housing and how it supports economic development. But I'm also just really struck at the leadership exchange on ageism and that model and what Emily and Jeff have just said about inclusion. And so I think there's an opportunity. I'll let you decide which way you want to go. Maybe you'll do both. Maybe you'll do one at a time.
So what's the question about the leadership exchange on ageism? I'm just sorry. I always answer that.
That to me, from what I know of it, having not participated, is the opportunity to bring people from different sectors together and have these conversations, whether they're about housing or transportation or what else is needed in community, in that one-on-one way that then allows for the ripple effect and the power in bringing folks together to have those difficult conversations about misperceptions and,
Sure.
and how that might translate in other communities, maybe not in the format of an LEA, but maybe in the format of just this bringing together. It's another way.
Sure, absolutely. And it's funny because as I was listening to Emily speak, first of all, I think house parties are exactly the way. I mean, I think that what you're talking about, I'll explain it in a second, but I live in Harpswell, and I live really close to an area that was left by the Navy to our town, and it's a large area that nobody's figured out what to do with for more than 20 years. And affordable housing is something, and that has come up over and over again. And it just came up and people are wild. And in my, like in my friend group, they are saying outrageous things. And like in my friend group, saying outrageous things is a lobsterman who's saying outrageous things, who's like driving to Brunswick to pick up his crew because there's no housing here in Harpswell. I mean, the disconnect is so amazing. And I think that's why I would say, so we run a program called the Leadership Exchange on Ageism. It's a pretty new, it's been around for about a year and a half, and we've had 200 people graduate through it, commissioners and sheriffs and CEOs and legislators. It's a terrific program because it's been evaluated as it moves people to take rapid action to address the age bias in their spheres of influence. And age bias is something we just don't even see. And the beauty of it is that it gives people 14 hours. Can you believe that 200 people have signed up? That we're about to have 24 more graduates to talk to each other for 14 hours. And that's the thing. We never get a chance to talk about these things, right? Our own fears about ageism. So that's what, that's what Emily, you're just talking about, our own fear about having people who are low income. By the way, they're all around us all the time, living as our neighbors, right? I mean, we have this fear we haven't been able to talk about. We need to have these deeper conversations with each other so that we can come to solutions that work for everybody. And I'll say why. I'll answer your other question too. which is, I mean, literally for years now, all of the research has shown, right, that housing, stability, quality, safety, affordability all affect health outcomes. I mean, this makes perfect sense. If you don't have housing or you're afraid that you're going to lose the housing that you have, it's a huge stress. And that stress takes over everything. That's why housing first is such an important thing, right? Because if you are focused on whether or not you're going to have to move at the end of the day, it's going to impact your ability to be a good employee during that day. I mean, like we can all just get that, right? So for some folks, they can just also, this is like what happens with older people in particular, is that and I just will put a little plug in to say, Social Security and or Maine State Retirement it masks poverty among older people, because it's just above, right, the federal poverty level for anything that's associated with that. And also you're just on a fixed income for your whole life. So you might have a house, but you might not be able to maintain that house, or you just have enough money to maintain that house. And so you keep your heat at 55 degrees and you only eat one meal a day and you only take your prescription drugs every other day. I mean, these are the things that lead to terrible health outcomes, just because you're paying for your housing and you're not able to pay for anything else. So Maine just concluded a needs assessment for it does a needs assessment every 4 years for the state plan on aging, and they talked to about 3,000 older people, 55 and older, and asked the question. Oh, by the way, I just wanted to say, when I say they talk to people 55 and older, that's 38% of Maine's entire population. I just like to make sure people are grounded in the understanding that we're not talking about a small number here. We're talking about a huge number of people. And they asked the question, does your current home meet your current needs? And 16% of people said no. Right. And the majority of people said they couldn't maintain it. They needed help with home repairs, and affordability was one of the top problems, was the top problem. So showing again that it's not just, right, people who are having challenges with rent, but it's that people really can't afford the home that they're in. They can't afford to maintain it. And the same survey found that 12% of the people, 12%, I mean, more than 10%, fear losing their home. And 51% said if they'd lost their home, they wouldn't have another option. So these are some really troubling, examples of big numbers that are impacting older people, and 55 and older, right? It's not that old. So we also have a situation that I just want to sort of highlight where our worker housing shortage is directly impacting the housing of older people, particularly older women who are in affordable housing, in that low-wage earners can't afford to live where they're providing care. So direct care workers who are working in home care, assisted living, nursing homes, often cannot afford to live. I mean, there are people who live in Raymond who are going to Chesapeake Island every day, right, to provide care in the assisted living facility there. So these folks don't get paid enough to do that kind of travel, or their transportation, is the cost of transportation, or their car breaks down, right? And they can't keep their job. So they try to get jobs that are closer to home. So it creates a lot of this sort of housing mismatch, and where there's affordable housing and where there isn't, creates a lot of turnover. And what we're seeing for the first time now is that older people who are in affordable housing who need home care, who can't get home care because we have a direct care worker crisis, are now being evicted, not because they can't afford their rents, but because they can't get home care. And, this is really the first time we've seen anything like that. So when you think about, the fact that our workforce shortage is causing other people to now lose their homes with no place for them to go, honestly. So I'll just lift up one last piece, which is a story I really like, which is and I wish this was in Maine, by the way, I really do. But it's just over the border in New Hampshire, in Dover, a place called Harmony Homes. It's a husband and wife, architect and developer, who own an assisted living facility. And they were seeing this exact same problem, that all their workers lived in Rochester. And if their cars broke down or they couldn't get daycare, they would quit. And they just had this huge turnover. So they built housing right where the assisted living facility was. They built 7 units, one designated as a childcare place, and it filled up so much they had 7 people on the wait list as soon as they had it built. And so he went to the town of Dover and said, look, we'll build, I think it's 45 or 49 tiny homes, and build a pocket community here. And we guarantee we'll have affordability based on HUD affordability measures. And if you let us do this for a certain number of years. And they said, great. And it's happening. So I just, I think we have to be thinking differently about these. There isn't one size fits all. And we need to be sort of thinking outside the box in relation to how we make sure people are being housed. So that's all I'm going to say.
Thank you, Beth. Love that example from New Hampshire. I have not heard that before.
I just dropped some information about it in the chat.
Thank you. Thank you. Christopher, I'm coming back to you. And the question that I had was, how could the community advance the issue? And I'm particularly wondering, how could the business community, given our audience, help advance the issue? And I'm particularly struck by the comment earlier about this town versus regional thinking. And I'm wondering if you think that the business community might have a role in maybe moving that conversation forward.
Yeah, well, I couldn't think for a moment, how do I respond to that? So this region has lacked really any development in decades. I mean, for example, there may have been, a few lake houses built, on East Grand Lake, but that's not what is needed. That's kind of that's not a year-round house. These are people often from away. This is their second or third home. They are not, in my opinion, particularly invested in the region. So we have this kind of town versus lake mentality. It's the wealth is around the East Grand Lake community. And yes, they appreciate getting gas, and maybe some services. But in my opinion, what we're focusing on is workforce housing, in the towns. I think there are individuals who would be willing to be co-investors, but the problem is, the analogy I make is, if we were all standing, many, many feet above lake water, more than likely I'd say, why don't you jump first? I'm not sure I'm going to jump first, but if someone else jumps, I'll go, assuming that the person jumps, pops out of the water, and doesn't go away forever. I'm pretty convinced that if we can get literally one housing development project done and it fills up, which I think it will, then what I would call kind of functional capitalism, that engine will take over. It's just what we're lacking is that first effort. And there's so much, I think, cynicism and skepticism at the local level that it's very, very difficult to get that first investors. So what I'm trying to find are some, can I find 4 or 5 investors who will take this risk? And if so, I think very good things will follow.
Thank you. Thank you, Christopher. Paul, so you spoke earlier about the zoning and the layers of bureaucracy, my word, not yours, that you have to go through. And so I'm interested in how you think about engaging local folks, business community, local neighbors for the advocacy and for the support to get to the yes in my backyard folks.
That's a good question. We spent up in Kingfield about $10,000 trying to engage the local folks. We had, I believe, 3 meetings that we hosted, inviting the local community. We hired a consultant to help us with the social media and our messaging. And we thought we did a decent job. Could we have done better? Yeah. But we did a decent job of it, and we got resoundingly defeated. And that's why, I've been through other projects like this where we got beat, and we did engage the community. So I've said this before, that NIMBYs have many faces. They're not all rural community people with maybe some biases or xenophobic or anti-government. I had a project in Freeport where they were relatively rich people who didn't want to see their town changed and didn't want to see a 3-story building because it was the only building that we could afford to build because we needed the density. And that's why I really am pushing more for a statewide response. Local control, it doesn't work when it comes to housing creation. It just doesn't work. There's a patchwork of how many communities in this state, 300, 400, I don't know. But we need 80,000 new houses, new housing units. And we can't piecemeal it with spending thousands and thousands of dollars in each little community to try to sway the public, which won't happen in many respects. So yes, you definitely need to engage the community, but on average, what I've seen is it doesn't work.
Christopher?
Yeah, I really appreciate, I can tell Paul knows what he's talking about. Well, all of you do, but so here's an example that I'm dealing with up here. Most of these small towns really they don't own land, right? So who owns the land? It are families, legacy families, multi-generational families, old farms. Now, they're fallow, no one's farming them, but they have vast estates. Well, why do they want to sell? They don't need the income. And as Paul said, why would they want more housing development? It's not, it comes down to individual interests versus human collective need. And so, I have to now try to find these people and try to convince them, as Paul said, it's a very difficult job, convince them why it might be in the local community's interest to have that farm field turned into housing. But you can see why that is a hard sell. The people that I work with, whether they are wealthy or poor, like the fact of isolation. They do not want new people coming in. And when I ask them, well, what happens 20 years from now when we're gone? What do you care about the bigger community questions? Generally, the response is, and again, I'm not disparaging this. I think it's a very honest response. Life is good right now. I'm doing fine. My children are fine. And so it really gets into a lack of collective concern for Maine over the long term. And so I really like Emily's, I think Emily is spot on. It takes these house parties. It's not, for example, if I were to try to convene a meeting of local townspeople to talk about regional housing, right? 2 people would show up. 2. I'm not exaggerating. It is absolutely a one-on-one conversation, but you can imagine how time-consuming that is. I could spend the rest of my career doing nothing but going door to door, trying to help people understand that I am not trying to bring in certain kinds of people, you know, et cetera, et cetera. So.
Thank you.
I just want to add a little bit to that. I think there's clearly value in having these conversations at the individual level. And Paul, to your point, there's a point where we just have to say we're doing this, and this is, you know, whether it's from the state or the you know, local community passing these ordinances, we need to be doing this, right? We kind of all know that. But one thing that I've found is the housing crisis is impacting more people that it has never impacted before, and specifically, at least here, with adult children having to move back into their parents' homes because they cannot afford to, you know, move back to their hometown. I've had more conversations with people who are like, oh, okay, I get it. I guess it would be nice to have, you know, an apartment complex somewhere so that my kid can move into there, or that they can buy a home. So I think that as it touches more and more households, people are more likely to engage in those conversations. But as we were putting on these educational events, Christopher, you're right. We had the same folks showing up who already support affordable housing. So that's not getting anybody else to be engaged.
The mindset shift to get to the collective, that's a big step. There's a comment in the chat asking the question about whether the same people who are saying I like things just the way they are, do they have enough first responders, police, firefighters, teachers, you know? And I think that goes to what you're all saying. There's no housing for those doing that work. Jess, go ahead.
Yeah, I mean, I guess I just want to sort of just lift up a little bit of, I think one of the barriers, or maybe it's, you know, it's what Christopher, it's what we're all talking about. It's what Paul just said. He has to build, and I've heard this over and over again from builders, a 3-story building for density to afford it. And the vast majority of Mainers in particular don't want to live in it. And therein lies, I think, a big problem, right? And they don't want to see it either, right? Because they don't want to see it and they don't want to live in it. And particularly older people who've lived independently in a single family home for their entire lives would move into a tiny home. They actually would, because they can have a garden, they can have a barbecue, they don't hear somebody upstairs or next to them, right? It might be closer than they want, but they're used to living in that situation, and they really don't. They hate the fact that everybody sits at the place where you go in and out, and they know when you're leaving, and they know what you brought in, and they make like there's a whole thing, right? So there's an ethos around all of this, which is why I think to Dalry, your question about, like, we need to have conversations about this stuff. But I also think, to Paul's point, we have to figure out a different financing mechanism to build what people want, instead of what we're trying to jam down people's throats right now, because that's the way we can fund it. And I've heard this over and over again from other developers too, like building that middle, you know, the housing in the middle, we can't figure out how to afford. And we've got to do it differently.
Yeah. Thank you for that, Jess. Caitlin, my colleague Caitlin Sullivan is here. She's the community investor for the foundation, works closely with many organizations in the state of Maine, across the state of Maine. So Caitlin, please join us. Share, does what you're hearing jibe with what you're seeing and hearing in your work across the state, and you know, what the foundation is seeing and how things can come together in different communities and what isn't working?
Yeah, thank you everyone for just a really amazing conversation. And, you know, as Alri sort of framed earlier, the foundation and Harvard Pilgrim really see health as everything that's happening in communities, right? Where we live, where we work. And so the foundation really invests in systems change approaches and policy advocacy and organizing, both at the local, regional, and statewide level. And housing transcends all of the issues that we really support, right? And so, as we're hearing today, the issues are incredibly challenging, take a multi-pronged approach when we think about partnership. And so we really invest in coalitions and collaboratives that are seeking solutions at multiple levels, but really taking a community first approach in understanding that in order for affordable housing to work, climate resilient housing to work, for folks who want to stay in their communities, it has to be community driven and community led. And so and the foundation really wants to be a part of that solution through our investments, but understanding that it really has to take an uplift community voice in that work. And so, just last week, I was in Washington County and had the opportunity to hear Christopher share some of his experience and work, and had stopped at six different communities, and to really hear about some of the opportunities and the challenges facing the region, and affordable housing and climate resilient housing, accessible housing for older people, affordable housing for young adults that want to stay in the community came up in every conversation. And so something that I've just learned, and it came out through this conversation, is just that Mainers have an incredible sense of place. And so again, driving right back to that community led and community listening approach really has to come at the forefront. And so and I think something that you shared, Christopher, that really just resonates is it doesn't necessarily have to start with housing. And so really understanding that people want to be listened to. And Emily, to your point, the dinner parties, like it might not be, come to this conversation about housing, but come to this conversation to say that we understand that you want to live in your community, or you want to age in your community, or you want to be able to come back to your community and be a healthcare worker, and play the many hats, or have the many kind of roles that you want to be able to have in your community and care about. But how do we allow that to happen? And so it might not be come talk about housing, right? And I think that's something that you've uplifted, Christopher and Emily and Jess, and through all of this work. I think that, the Millbridge example from where I was just last week, there were three just very folks in different spaces in their lives, and all talked about housing. And so one example was a seasonal farm worker family that doesn't just want to be seasonal workers coming from Mexico to serve in the fields, but really want to create a sense of community, and now are owning businesses in this community. But affordable housing and accessible housing was something that was a barrier to their family. Multi-generational commercial fishermen families that are thinking about, how am I able to live in this community through spaces that are accessible to how you're aging. And so I think, that listening to understand, but also being able to act on that community input is something that the foundation really thinks strongly about, as well as funding organizations that are doing both statewide advocacy, potentially national advocacy when you think about the care workforce, and some of the reimbursement rates in respect to that. But I know we do have time for questions, and I want to be mindful of that.
Yep, I've been monitoring the chat. We don't have any unanswered questions in the chat at this point. But if folks do have any, we've got a couple of minutes.
Could I go to one more then? Which is the what's next? I don't want us to just get together, have a conversation. I want us to figure something out. I guess that's just me. But I'm wondering about, is there value from this group of really interesting people? Is there value in another meeting to discuss and getting together more and talking about how we can fix this around the state? Or does somebody know of something like this that's already happening that we could help with?
I think there's been a lot of conversations, Jeff. I mean, a whole lot of them. I think this conversation has definitely surfaced this issue. That's been great, a really good conversation. So to me, thinking about how we could identify, and I don't know if there's anybody here from Maine Municipal Association, but I think about, how can we identify communities that want to be early adopters, that want to really think through, that want to sit down with Maine Health, and I mean not Maine Health, sorry, well maybe Maine Health, Maine Housing, and funders, and whatever, whoever we need to, business leaders, to say, we want to solve housing in our community. We want to be early. We want to be good partners. We want to do this. And so we'll drive our energy into creating opportunities for conversation. The one question I had for everybody, because I've done a lot of work with Plan New Hampshire, and they, for the last many 20 years, have done housing charrettes in communities. And one of the things they found really consistently is they could bring in a charrette and do beautiful planning and like come away with this incredible plan that the municipality could never sell to the people because of all the things we've been talking about. So, when I talked to them about this, they said, well, what we recommend now is like that the community do all the work up front to say, yes, we want this. And then you do a planning charrette. So I think that's the kind of thing when I think about is like, where do we find a couple of communities we could just use as like test cases, right? To say, can we shift this view? Can we build what we want to build? Can we take some money, right, that Maine Housing has as discretionary money to say, and a bank, or some of our CIE, or whoever, to say, let's put this together and make it work a couple of places in a couple of different ways, and then go from there. I don't know. That's my take.
I mean, what we've seen is there are many organizations, as you said, working on this, and they cross business community and charitable organizations. Our organization in the Western Maine Mountains is a charitable organization. Maine Real Estate Development Association is a nonprofit, but it's more for the trades and the builders and the developers, and having fair and predictable laws. Maine Affordable Housing Coalition is working on this. A wonderful organization. We can partner with all these organizations. We don't have to do it ourselves. I honestly think the best solution is a statewide solution, although, of course, we need local engagement. Maine Municipal Association is generally against these statewide solutions. They're protecting the local zoning and local control. So I'm not sure Maine Municipal at this point is part of the solution. They want local control because that's who they represent. We need to work with the housing in Augusta, the housing committee, which I think is going to be a standalone committee going forward. I think that's what I've heard. Matt Pouliot, who's actually a Republican, but he's incredibly supportive of what we're all trying to do. Unfortunately, he's retired from the legislature. He was a member of the housing coalition and the housing committee up in Augusta. So I think the biggest bang for a buck is statewide, but of course we need to do things locally also.
Your hand, Chris.
Hold on just a second here. So I just want to tag on what Jess just said. I mean, my understanding of change and change theory is that it's very difficult to get anyone to see the change. I mean, you have to create the future that people can see. You can't talk about it. It has to become a reality. And then the fear, the suspicion goes away. If we could build several models, pilot projects throughout the state, both rurally and remote, and then in urban centers, and then promote them, advertise them, market them, I have a feeling if people could see it, we would probably have some progress. Again, it's the problem of we don't have anything to look at. especially in rural communities in Maine yet.
Emily, you had your hand up, and we're approaching time after you, Jeff, if you have any last words, or Jake. I'm sorry, I think it was Jake after Emily.
Yeah, just real quickly, as we were talking about what the business community can do, we've had a couple examples down in this area where businesses have used some land that they don't need necessarily to build housing on. Their Kennebunk Savings Bank just partnered with Avesta Housing to build a pretty significant senior housing development behind their operations center in Kennebunk. And there's a couple other smaller examples down here as well. So I just wanted to add that in there because I think that is a way businesses can be involved in the solution.
Well, thank you all. I really appreciate everybody's involvement on the great discussion today. I think this is probably something where an hour and a half may not do it justice, kind of as we've alluded to, and a lot of these conversations have been had maybe in different sectors, but bringing everybody together and kind of starting that, I think is really, really valuable. I do want to turn it over now for our closing remarks to Christine Austinfort. She's the Senior Director of Government Relations for Anthem Blue Cross and Blue Shield, and somebody personally that I have gotten to know over the past 4 or 5 months in here, working with the chamber here, who has helped me immeasurably with work over at the State House. So, Christine, I will turn it over to you.
Thanks so much, Jake. On behalf of everyone here at Anthem, I'd like to thank you all for taking the time this morning to talk about this very important issue. We'd also like to thank the Chamber for sponsoring this discussion, and particularly our awesome speakers who did such a fabulous job covering this incredibly comprehensive issue. Here at Anthem, we are committed to improving Mainers' whole health, their physical, mental, emotional, and social well-being. And as we've heard this morning, affordable housing has a wide-ranging impact, and it is a health issue. Housing is one of those many social drivers that impact our health, and studies have shown that 80% of health outcomes are determined outside of the provider's office. Having access to nutritious food, secure housing, reliable transportation, all impact someone's overall health. And it is an access issue as well. I have a friend who is trying to hire someone to work for an office in the Mid-Coast. It's a newly licensed social worker looking to move to Maine. And she may lose this person to another office in another part of the state because there's no affordable housing for this individual. It is an area that touches all segments of our economy and all segments of our friends and neighbors, not only young people like this woman who are looking to move to Maine, but as Jeff talked about, our seniors who either are having trouble staying in their homes or having trouble relocating to more affordable housing. Maybe they need, a single floor residence now instead of the old farmhouse that they raised their kids in. So we are very pleased to sponsor this forum to begin the discussion about these types of challenges. And it is a challenge that we all must work together to address. And thank you all so much for your comments this morning.
Thank you so much, Christine. And before I close this thing, Jeff, any last words from you?
I think this was a fantastic meeting. We're over time, and so I'm going to say let everybody go, but let's keep talking.
And going forward, just so you know, this was a recorded conversation. So within a couple days, you should be getting links out to folks if you do want to play this back at any point in time. And if there are different connections that want to be made, reach out to myself or Richard over at the Chamber, and we'd be more than happy to make those connections as these conversations go forward. So hopefully everybody enjoys their short work week here this week, and really appreciate everyone's participation. Thanks.